You are watching UNICEF television. On the outskirts of the Somali capital Mogadishu, women have turned out in large numbers to receive medical and nutritional care for their malnourished children. These women and children at the outpatient therapeutic program in Hodan district are among tens of thousands of newly arrived displaced persons who join the 180,000 IDPs already in Mogadishu. Here the mothers are taught good hand washing and general hygiene practices. Safe water continues to be a challenge, and women and children are the hardest hit, particularly in this time of continued food insecurity and conflict in Somalia. The centre is always busy, with up to 400 children being brought in each day. This is the fourth time Palestine has brought her malnourished child for medical and nutritional follow-up.
I came to Mogadishu because of fear of fighting in Johar town. My baby's condition was very bad when I first brought her here, but now she has really improved. We are getting clean water from the center because at the well, the water is not clean for drinking.
There's a strong link between poor hygiene practices and illness. Lack of safe water and bad hygiene can cause malnutrition and prevent recovery. That's why the NGO Said, with support from UNICEF and other partners, is not only providing nutritional care, but also a critically important water and hygiene programme, which includes sensitization on good hygiene practices and hand washing.
We put more emphasis on health education. We ensure that mothers know how to clean their utensils, bathe and wash their children's clothes. We also emphasize on the importance of washing hands every time they use the toilets.
For Syed, getting the word out about hygiene means getting the word out about safe water. Mothers who come to the centre receive a bucket, soap and aquatabs for household water treatment.
There is a great improvement in the condition of children because you see, cleanliness and nutrition go hand in hand. When a child is clean, his health condition improves. There are no disease outbreaks when good hygiene is observed.
An outreach team also visits IDP camps to educate families about household water purification and safe storage, and to sensitize them on the importance of washing hands and home hygiene. The connection is clear. With fresh, safe water and good hygiene comes health for children, adults and entire communities. This is Susanna Price reporting for UNICEF Television. Unite for Children.